Welcome to Financial Insider Weekly. I'm your host, Michael Gray, CPA. My guest today is Don Pollard. Don is a chartered life underwriter and chartered financial consultant, and he's an insurance broker at Advanced Professionals. It's a regional insurance brokerage company headquartered in Northern California, serving about 350 clients. The company offers employee benefits and executive life and disability insurance planning. Don has worked in the insurance industry since 1973, only yesterday, and at Advanced Professionals for 16 years or so now, I guess.
Years.
Yeah, oh my goodness. He's managed insurance agencies and trained agents, and Don is a past president of the Silicon Valley chapter of the National Association of Insurance and Financial Advisors. So because health insurance is such a critical area, we devoted some consecutive interviews with Don about healthcare reform and choosing medical insurance coverage. And you can find those interviews about healthcare reform under past episodes at financialinsiderweekly.com. But we're going to be talking about in more detail now because healthcare reform is being implemented. So really that's what these interviews are going to be about that we're going to be doing for this week's show and for next week's show. Today we're going to be talking about health insurance for individuals. So first of all, again, I want to caution our viewers that rules for medical insurance vary from state to state. In fact, how they cooperate with health reform is varying from state to state. So be sure to work with a consultant who's familiar with your own state laws. Okay, Don, welcome. Thank you very much for coming and being a guest.
Thank you, Mike.
Okay. So, Don, some people view medical insurance as like, the American Express commercial. Don't leave home without it. What do you think?
Well, I think that's a good phrase to take advantage of for all of us. And the reason for that, Mike, is that in California currently we have roughly 7 million people who are uninsured.
Wow.
And there was a study done, and the cost to the rest of us for the uninsured people averages out to about $368 in increased premium per year for a single person, and roughly $1,000 a year for a person with a family. So it's important for all of us to think about the statement of not leaving home without it.
Okay. All right. Well, we've got health care reform. It was enacted a couple of years ago, but they sort of had a delayed implementation. How's the big picture changed for individuals for medical insurance?
I think the one critical thing, which we all knew that this would solve the problem, is of accessibility for individual people. So insurance now, beginning in January 1st of 2014, is going to be available to every citizen regardless of their medical history and past records. Guaranteed issue is required for all in the new law, even for individuals.
Great, okay. So now we're coming up to a critical date, January 1st, 2014. Why is that date important?
Well, that's when the final provisions, or the majority of the final provisions, kick in for the law on January 1st of 2014, a mere 252 days from now.
Okay, so today is April 23rd, 2013, in case you're wondering when we're recording this. All right, so some people may have started to hear some buzz about exchanges. What is an exchange under this healthcare reform?
Well, an exchange under health reform is an entity that is going to be organized in every state to manage and provide a level of benefits for all people to have access to. So the idea of the exchange is they're to offer the choice of health plans to the people. They're designed to provide information to customers about those plans, and also to allow a mechanism for people to enroll in the plans. And one of the big benefits of this exchange on the individual side is that now we are going to de-link the access to medical coverage from employment, which it's been connected to for a long time.
Yeah. So anyway, so it sounds like to me like it's probably going to be like a website you're going to go to, and then you're going to have comparable information there for various plans.
Yeah, they're going to have a facility to compare on the site. There will be multiple other options for people to obtain help in their getting the information for the plan. So, yeah, so it's going to be designed to do the whole thing.
So when are we supposed to know which plans are participating in this exchange process?
Well, the exchange has told us that we will know the carriers by May 15th. And they were excited because we had a lot of carriers in California apply to be in the exchange. And we in California are in a position where we're not going to let everybody in to our exchange. So there may be some other states where they're not going to have as much interest. But that should be May 15th. And then they've said that we should know the premiums by July of this year, 2013.
Okay. So what are the things that are required to be included in the plans under this healthcare reform?
Well, one of the keys to the ACA, which is the act, is that it mandates that an essential benefit package is provided. And those essential benefits are going to be doctor's visits, hospital, prescription drugs, lab benefits, emergency care, preventive services, maternity, pediatric, and mental health and substance abuse. So you can see it's a comprehensive set of benefits that will be provided, and those are required to be provided under the law.
Okay. So what levels of coverage? I guess all the plans aren't going to be the same. They're going to have like a different levels or whatever of coverage under these various.
Well, the whole idea of the exchange and part of its objective is to simplify the choices of the citizens and their ability to make a good choice. And through that, they have designed, again, the essential benefits that must be covered. So all plans will have those benefits. Mm-hmm. And then they have also designed what we call the metal levels of plan, which determine the percentage of a person's expenses that would be covered and paid under the plan. So as an example, the bronze plan, which is the lowest level plan, is designed actuarially to cover 60% of a person's estimated healthcare costs during a year. And so there's bronze at 60, then silver, then gold, and then platinum at 90%.
Okay. So, and then the trade-off is obviously you pay more premium for a higher percentage coverage, and so you just have that trade-off there and have to decide how much of it you're willing to shoulder yourself.
Exactly, and that hasn't changed from before. And I think the other piece that hasn't changed is that people will have to pay something for their care, premium and in cost sharing when they actually go to the doctor. So that has not changed. What they've done is just basically it tried to simplify the process of choosing, which is that's a favorable result of the whole exchange system.
Okay, so what if I need to get help because frankly I'm just having trouble understanding. I'm looking at these and my eyes are sort of glazing over, and there are some people, of course, that are more computer savvy than others. So how can you get help in finding your way through this?
There's multiple ways that have been set up under the law for people to gain help. The first, I think, place where people would go is to the website for Covered California, and I think they have that up on the screen, or they will in a second. It's www.coveredca.com, and on there they have detailed information about what the exchange means and how to basically get coverage implemented for you. So some of the information they provide are fact sheets, how to do it type exposés, and then they have a small business sheet that talks to small business people about what it is for them. Also, there's going to be individual people that are assigned the task of helping, and those are in a couple of different categories. There's going to be the non-licensed people, which I'm going to call assisters, and those people are usually going to be attached to community service organizations, nonprofits, that kind of thing. And what they'll basically do is help people, guide them to get the right information, and then guide them through the process of enrollment in the exchange. The other place of help would be from an agent, a licensed agent, who has undergone training to become a part of the exchange process, which will then allow them to help people, to guide them in their decisions. A key factor to note here is that the assisters, the non-licensed people, they will not be eligible under the law to give a recommendation to you as to which plan might be best based on your situation. So all they'll be able to do is actually provide you with information. The agent, the licensed insurance agent, is the person who will be able to assess your situation and then give a recommendation based on your particular situation as to which plan or plans would be more favorable for you.
Okay. Now, you mentioned that there's this website. Is it coveredca.org or .com?
.com.
.com, okay. And is that the place where you would find things like these tables that we were talking about?
Exactly.
Okay, so there's information here that they explain the differences, for example, for the different levels of coverage. And folks, we just decided the lettering is too small to show you on our television show, so we want to just direct you to the website.
I will say, Mike, that I do have a package of these in PDF format, that if anyone would care to have them and they want to email me, I'll be glad to email them back to them. So my email will be up either at the beginning or the end. So or you can get it from Mike at his office. So that would be another method.
Another way that you can get this information. Okay. All right. So we've got about 15 minutes left just to let you know about where we are. All right. So these individuals that you've been talking about, the assisters and so forth, what kind of training are they going to have?
Well, the agents, I know about that training because I am an agent.
Right.
So I'm interested in that, obviously. But currently, the state of California, our exchange, the Covered California Exchange, is going to require 25 hours of specific training relative to the exchange, relative to the products of the exchange, and relative to the situations and the helping of people through that. Now, other states may have different recommendations, and in fact, our state may even change those. So those are not finalized at this time, but currently roughly 25 hours.
Okay, so that's like 3 days of classes, I guess, that you more or less have to go through. So what kind of financial assistance is available? There are obviously the people that can afford health insurance now. They're the ones that probably have the coverage.
Exactly.
But the people who don't have it now may need some additional help. What's going to be available for them?
Well, again, I think this is an area that I think that the law is sensitive to, is that people just are unable to afford the coverage, and therefore they don't have it. And so they basically designed three different types or levels of assistance, financial assistance that people can have. They take the form of a tax credit, and the tax credit method is applied against a premium. So if a premium is $600 a month and you qualify for this tax credit based on your income and your family status, that premium might be reduced to $200 a month, something of that type. So it's designed to work around the premium. There's also a cost sharing option, which reduces the cost of care when a person goes, and that's again, eligibility is based for all of these types of financial assistance on income opposite and consistent with family structure. And so the cost sharing would have the effect that possibly if the deductible might be $500 in a plan, and you qualified for the cost sharing reduction, that deductible might go to zero, so you wouldn't have a deductible at all. Or in the area of a copay, for example, maybe the copay for a doctor's visit is $30 under a silver plan, and you qualified, maybe that copay would now be $5. So two different methods there. And then for the Medi-Cal is another option, and I know we've heard a lot about what this is going to do relative to the state and the structure, financing of the state. But Medi-Cal for the lowest income individuals is going to be a free, no cost type of cover for them. So that should put us in pretty good shape relative to the entire amount of people. I also have a real nice table that I'm happy to send along that would show kind of visually how that would work relative to a family's income.
Okay. Now we say cost sharing. It sounds like what's happening is the cost is being shared with the other participants in the plan. In other words, this person is not going to have a deductible because they're a low income. And so that means the insurance company has to make it up someplace else, and so they're going to have to make it up in a premium. Isn't that right? Or
Well, yeah, the cost sharing is between the individual and the government.
oh, and the government?
So the government actually subsidizes this.
Oh, okay.
So
So they're going to pay the insurance company for the shortfall.
Yeah, I'm not exactly sure operationally how it would work, but that would be the idea. Yeah,
Okay.
that the government's going to make up the difference based on the funding that they have set aside
Okay.
to do that.
Okay. All right. Well, what if you don't get coverage?
Okay.
What if you, for whatever reason, you decide you can't participate in this thing? You know, are there penalties that apply?
Yeah, and as you know, and your listeners probably know, there was a big brouhaha and a Supreme Court law case regarding the mandate that people buy insurance, and that was affirmed that it was constitutional for the law to require that people have insurance. So now, beginning January 1st, you will be required to have medical coverage. And then if you don't do that, there will be penalties assessed against on your income tax return, basically is how they're going to administer that. So 2014, the penalty is 1%, the greater of 1% of your income, or $95, so pretty inconsequential. In 2015, it's the greater of 2% of your income, or $325. And then in 2016, when that takes full effect, that's going to be 2.5% or $695, whichever is greater. So that'll be something that each individual person will assess on their own relative to the purchase of the plan.
So are there certain groups that are exempt from participating in this, where they can avoid a penalty just because they happen to be a member of certain
there's
groups?
the standard religious group exception, those types of things, but I think that the majority of people are going to fall under this umbrella, if you will.
Yeah. Okay. So, but when you listen to these penalties, it sounds like, especially for 2014, okay, well, let's say you're an individual and you're not a high-income individual. I'll just throw out a number, $40,000. Okay, so that's hardly can make it in Silicon Valley type of an income. Mm-hmm. So that person, if we take 1%, that would be $400, I guess. Mm-hmm. Whereas if they had got the coverage, they would have had to pay considerably more than that, probably, for a year's coverage.
Yeah. Well, again, I think what the situation would be for each individual person is that person who makes $40,000 may qualify for some form of premium assistance or subsidy. The other issue is that, which we'll talk about at another session, is that employers now have a mandate to provide coverage, and they have a mandate to provide affordable coverage, which is defined as no greater premium share than 9.5% of your income on a monthly basis. So the people will have the opportunity to assess that against going without. And I think, as with anything else, this is designed to try to get people coverage that have not been able to get coverage in the past. And if we try to figure out ways to not do that, we're sort of defeating and overcoming the entire purpose of the bill. And that is to provide our citizens with adequate and good, high quality medical care.
Right. So I was just pointing out that there's this trade-off, and this is going to be going on in people's minds.
Exactly.
But for all of us, we don't know what's going to happen when related to our health. And all you have to do is get a little skin cancer, and suddenly you've got thousands of dollars, and if you don't have insurance to cover it,
Right.
then that's got to come from some-place. And so, so we do want to have everybody have this coverage. It is important, but people are going to have these little scales that are going on in their minds,
Sure.
especially lower-income people.
Well, and I think you also have to take into consideration that a person who elects not to have insurance and just pay the fine, they're still liable to pay for the services when they need them. So it doesn't mean that you're excused from paying just because you don't buy insurance. It means that you don't have any secondary payer to go to. You're basically self-insuring for that period. And in most medical scenarios, self-insurance for individuals is really not a good idea, because you really don't have the method, like you point out, of knowing what's going to happen and being able to plan for that in advance.
Right.
So again, the
Yeah,
reason
everybody
why
says that's not going to happen to me, but
yeah, exactly.
that's the people that things tend to happen to quite often. Okay. So when do we need to really get enrolled into these plans?
Well, the enrollment period begins October 1st, and it runs through March 30th of 2014. So there's plenty of time to get going on it. And again, premiums will be out in July. So the people that are able to assist you will be able to let people know how much it might cost them at that period, at that point in time, and then they can make an assessment. And I think the key here for in California, 56% of our people have insurance through their employer. So for them, there's going to be two types of calculation. One is what's going to change with my employer's situation, if anything, and then how does that relate to what I can do on my own in the exchange? Because again, as I pointed out earlier, one of the benefits of this long haul is we now de-link employment with the access to quality health care, and then that's going to be a positive thing when it all shakes out in the long haul.
Yeah. So another thing that we haven't gotten into much detail about, but as I said, some states have basically said, we're not going to do it, feds, you do it. And so we're going to see a different implementation, I guess, in states like those.
Across the country, right? And California was the first state to set up their exchange. So we've been on board from the beginning, and to me, that's a good idea, because I mean, to dig your heels in and try to say it's not going to happen, it just doesn't make any sense. And now those people are now going to have the federal government having to come in and operate their particular exchange, which may or may not be as favorable as the state. In California, by the way, Mike, we've had in the past a state-run exchange. We had the HIPIC, the Health Insurance Plan of California, that operated for some number of years, and was a really good option, and then they couldn't make that work. So
okay, now if I already have coverage either through my employer or individually, what is the impact? What,
Well, I think prudence says that you're going to now look at what's available currently from your employer, what you have, or what you have individually, and what's available individually, and then also look to an exchange type possibility and see what you can get there. So it is gonna cause everybody that currently has insurance, in my opinion, to actually think about it a little bit. Again, you can go on the website and get plenty of information, or you can contact a professional agent to get their help and input on it. But everybody, I think, should do it.
okay. So folks, see, this was an important show for you to watch today. What we're saying is everybody needs to look at their medical coverage again because of the changes that have happened related to health care under this new federal law. So this is very important as an alert, and so we wanted you to be aware of it. Don, I want to thank you so much for coming today,
Thank
being
you.
my guest, sharing this very important information with us. Folks, again, check out that website that we've been sharing with you along the way in this show, and look at that information and see about getting some help if you feel that you need it. With that, we'll see you next time on Financial Insider Weekly.